Hello, my name is Andrew. I'll be conducting my abdominal exam on you today. I'm just going to let you know that this exam composes of me inspecting, listening with my stethoscope, also percussing, and then finally palpating your abdomen. Do I have consent to do this with you today?
Yes.
Okay, perfect. So first thing, you're going to have your patient lay down supine with their legs supported. You're going to tell your patient to relax during this exam. And then you're going to go ahead and make sure that you go ahead and move on to inspection. So we're going to inspect the abdomen here, noting any kind of masses, noting any pulsations, noting that the color is warm, dry, pink, and intact. The only thing that is abnormal on inspection is there's some styrene over here on the left side. Okay? And making sure that there's no evidence of jaundice or anything like that. Okay? After that, you're going to move to auscultation. And you're going to listen to all four quadrants of the abdomen, beginning with the right lower. And you're going to listen for bowel sounds, which will be heard as gurgling. All right, your bowel sounds are pretty big. We must have just ate. And you're gonna note that the bowel sounds here are normal active. If you had to, you would listen to each bowel sounds, each quadrant up to 5 minutes to identify bowel sounds. Okay, after that, you're gonna go ahead and listen to her arteries. And you're gonna begin here right up top with the aortic artery. And then you're gonna move down and to the right and listen to the right renal artery, then right iliac artery, and then the right femoral artery. Okay, and then you're going to do the same thing on the left side. You're going to go a little bit left of the midline and listen to the left renal artery, left iliac artery, and left femoral artery. You're going to note that the patient has no bruits, which is a good finding. If she had bruit over the aortic artery, that would be indicative of a AAA. So that's good that she doesn't. The next thing after auscultation, you're going to move on to palpation. So I'm going to go ahead and put my hand here and palpate your abdomen now, okay? So you're going to note that there's dullness in all four quadrants. Then you're going to I'm going to go ahead and palpate now for your liver on the right side, moving all the way up to the right costal margin. And I'm going to say that with percussion, that her liver is about 6 centimeters. We're going to do the same thing and percuss for the spleen. Okay, perfect. And the last thing, we're going to percuss the bladder. Perfect. And then you would do a fluid wave test. I'm just verbalizing it to check for ascites. Ascites would be extra fluid in the space of the abdomen, which we don't have here. Okay, we're going to move on to palpation now. So you're going to lightly palpate each four quadrants of the abdomen. You're noting for any abdominal guarding or tenderness or any kind of pain. Do you have any pain anywhere?
No.
You're going to move on to deeper palpation now in each quadrant. Any kind of pain anywhere in any of these quadrants?
No.
Perfect. Then you're going to go ahead and move on and palpate for the liver. You're going to use the hooking technique. Okay. All right. Now that you're done with that, you're going to attempt to palpate for the spleen, which is also in the white quadrant, the same as the liver. And that's negative. Okay, perfect. No, we don't feel any spleen. And you're going to have your patient in breathe in. So we're going to do that again. I want you to breathe in while I feel for your liver here in the white quadrant. Perfect. Breathe in again so I can try to attempt to feel for your spleen. Take a deep breath in. Perfect. All right. So there's no hepatomegaly, no enlarged liver, and also I can't feel the spleen. That's a normal finding that indicates that there's no enlarged spleen. Next thing you're going to do is you're going to check for appendicitis in the right upper quadrant, and you're going to palpate down deeply and ask, do you feel any pain here?
No.
Okay, and that would be a test for appendicitis at McBurney's point, which would be the right upper quadrant. Same thing, you're going to test for Murphy sign, which would be left in the right lower quadrant. Any pain here in the right lower quadrant?
No.
And that's a negative Murphy sign, which would be indicative of cholecystitis. Okay, you're going to have your patient sit up. This is the last test. You're going to check for CVA tenderness. And you're going to hold your hand like this in the back peritoneal region and give it a strike with your palm facing up. Any pain there?
No.
And you're going to do the same thing on the other side. Any pain there?
No.
Perfect. Okay, and that test is negative for CVA tenderness. Okay. I also want to note when I was doing my percussion, there is no tympany felt over the liver and also no tympany felt over the spleen, and that would be a normal finding that those organs are not enlarged.